All righty. Good evening, everybody. I will just wait till all our participants come through. They're all jumping in now, which is great. Just give you all a minute. And excellent. All coming through as we speak. All right. So welcome all of you to Transplant Talk Live, the Arrow Foundation's webinar series. We're very fortunate to be able to provide our audience with some fabulous content and topics relating to all things BMT, with tonight's webinar discussing the very important topic of exercise and BMT. I'm Angela. I'm the Patient Liaison and Communications Officer with Arrow. I'm a mother of a BMT transplant recipient, and I'm an avid advocate as well of exercise as a nurse, PT, and a rehab assistant. And I'm joining you today from the traditional lands of the Wadawurrung people in the Geelong region of Victoria. I have with me this evening our wonderful host, Yvonne Panic-Hudson, who is amongst many things a clinical nurse practitioner in haematology at the Peter MacCallum Cancer Centre and the Royal Melbourne Hospital. And she is also the co-host of the fabulous and the very informative and very popular Straight and Marrow podcast. Yvonne is one of the directors on our Arrow board, and she's joining us today from the traditional lands of the Wurundjeri people in Naarm, Melbourne. Along with Yvonne, we are really fortunate to welcome two wonderful panellists with us tonight. We have Shaza Abo. She's the Physiotherapy Clinical Lead at Peter MacCallum Cancer Centre, and she's also joining us from Naarm, Melbourne. And I have Sage Wilder, who is a Leukaemia and BMT survivor, a health coach and a personal trainer, and he's joining us from the traditional lands of the Gadigal people, Sydney. I'm going to shortly hand over to Yvonne, who will be facilitating our Q&A this evening. We'll hold this on the completion of both Shaza and Sage's presentations. Please, if you do have any questions throughout the session, pop them in the Q&A session. You're more than welcome to also use the chat section. We will be monitoring that throughout the night. We do, though, please ask you to keep in mind that whilst we are unable to answer any questions regarding your own health status, we can absolutely provide general advice and answers. But if you do have something that comes up within this webinar that you would like answered specific to your own diagnosis, we do request that you please reach out to your treating healthcare teams. So we have a great session ahead of us tonight. So without further ado, I would like to hand over to Yvonne. Thanks, Yvonne.
Thanks, Ange. I'm particularly excited to be hosting tonight's webinar as someone who loves exercise. For those of you who don't know, I'm actually training for the Sydney Marathon and I'm fundraising on behalf of Arrow. So look up my fundraising page.
Thank you.
Getting there. Shaza and I have a long history. We've co-published on exercise in BMT and know each other well. And I'm absolutely delighted to meet Sage tonight and hear his story. So without further ado, I would like to welcome Shaza Abo to give her presentation. Thanks, Shaza.
Thanks, Yvonne. It's awesome to be here. Thanks for inviting me along. I'm just going to grab my slides. Bear with me. Whoop. Sneak peek straight ahead.
Yeah.
Okay. Are we all good there?
Perfect.
Lovely. All right. So thanks, Yvonne and Angela, for facilitating this and asking me along. Like Yvonne said, I have worked a lot with her in sort of exercise and the bone marrow transplant population. So I'm going to try and keep this relatively casual, but I'm trying to talk to you about the importance of exercise across the continuum of having a transplant and what it might look like for you, realistically speaking. So, is this working? There we go. Who am I? Just to paint the picture of me as a real person. So that's me in a little exercise study we did with Yvonne and some of the patients at the Royal Melbourne Hospital. This is me attempting to run a marathon or half marathon. And then I just want to mention that, life is ideally, I love exercise, but then I have gone from loving running and hiking to having two little kids, and we live a slower life now. So kind of just trying to set the scene for doing exercise at your pace to fit into your lifestyle. So, is exercise revolutionary? Well, we all know that the answer is no. It's been around forever. So this is just a really basic, no-brainer for us. Sorry, I'm having trouble with my slides. Here we go. Okay. Sorry, this slide bar is in my way. Good on me. I guess, again, I just want to go back into the history of exercise. So it dates way back. I'm not talking to you about something that's brand new and revolutionary. Everybody knows that exercise is beneficial. So even when all is known, even Hippocrates said that exercise is going to be something that's incredibly important, as you can see from these quotes. So Thomas Edison said, "The doctor of the future will give no medicine, but will involve the patient in the proper use of food, fresh air, and exercise." So I probably should have started by saying I'm a physiotherapist that works at Peter Mac as a clinical exercise expert, but I also do research in exercise in people with a bone marrow transplant. So that's my scientific little background there. So because we know exercise is so important, governments all around the world have created these exercise guidelines, and there's global consensus that from, this is a snapshot of Australia, UK, and the US and the World Health Organization. But essentially the emphasis at the moment is to really try and limit or break up your sitting time or sedentary time. So even short bursts of activity will help have improved outcomes for your body in terms of blood and oxygen flowing and keeping your energy production and energy levels up. The other focus of the guidelines around exercise are around aerobic exercise and strength training. So if you haven't heard this before, you will know that the advice is to try and be active from an aerobic perspective 5 times a week, aiming for 30 minutes or more. So it might be a 30-minute walk, 30-minute bike ride, that sort of thing. And then strength training is working on making your muscles, building the muscle capacity and aiming to do that 2 or more days a week. So these are international guidelines that's well known. Then the question is exercise revolutionary in cancer? Well, it's probably, as per this quote, so some of our colleagues did some research asking general practitioners' views on exercise about nutrition in cancer, and this is just a nice little snapshot of that. It's probably better than any medication we can give you, is what one of those GPs quoted. So exercise is not revolutionary in cancer, as we are finding out, because the growing body of research is showing it has a really beneficial impact. So I thought I'd just briefly touch on the science of how, I guess, we think physiologically exercise can have an impact on and in your health, and particularly in blood cancers. So this is from other research. It's quoted at the bottom from Sittlinger in 2020. But exercise is proposed to decrease systemic inflammation, also proposed to improve immune function, and then thereby can improve the recognition of and the killing of tumour cells. So you'll hear, I guess, that's through the mechanism of macrophages and natural killer cells and T cells. So I've got that there in case you wanted to read it, but just in summary, essentially we're trying to, exercise is showing that it's enabling patients to physically tolerate greater dosages of cancer treatment, or it may have the physiological effect of reducing side effects so that patients can complete their treatment. So it seems like exercise is a no-brainer. Again, this is one of the quotes from one of our participants in a project we did at Royal Melbourne Hospital. So it's a no-brainer to have some sort of structured program to help people. Otherwise, they'll be lying on a bed for 3 months and nowhere in 100 days. Yes, it's a no-brainer, but there are complexities. So I wanted to show this diagram of, I guess, acknowledging the complexity of having a transplant and what it might look like for you. I know Sage is going to talk through his personal experience in a lot more detail, so this is a little bit of a summary, and I know people listening might be at any stage in their journey. But it's kind of just a schematic drawing of acknowledging that even in the lead up to having a transplant, you're going through lots of medical appointments, blood tests, other sorts of tests, and maybe some inpatient admissions for your chemo or radiotherapy. And then you have your actual inpatient admission for your transplant, which might be anywhere from a couple of weeks to a couple of months. And then you have all that follow-up as well. So it's, post-transplant, outpatient clinic, and eventually you're hoping to return to your normal life. So this process might be months and months, and it's different for every person. But essentially this is trying to show you that it's understandable that there's going to be a disruption to your routine, to your physical activity levels, to your work life, to your family life, and you might be more sedentary, or you might spend more time naturally sitting in a waiting room or sitting on the couch at the end of the day because you're just so tired from everything you've been doing. And I guess I just wanted to highlight that across that process, depending on where you are and your access to things, there may be limited support in terms of exercise professional support from physiotherapy or an exercise physiologist, for example. And so there are lots of common symptoms that people listening out there might be familiar with. Again, I just wanted to show you what it might look like for you. Everybody's different. And these symptoms might also come out as barriers to exercise for you. So we know across the continuum, so before transplant, during transplant, and after, in the research, we hear people have fatigue, reduced quality of life that's associated with their health, reduced psychological well-being. There might be fluctuations in weight. Usually there's a loss of weight with transplant, pain, reduced functional capacity, so your ability to get up and do the activities that you would normally do is often diminished. And there's also an impact on your cardiovascular health that might lead to increased risk of cardiovascular disease, so heart and lung disease. And there are lots of contributing factors that might cause these symptoms and side effects. So it's the side effects from the blood cancer diagnosis itself, whether that's a leukemia, lymphoma, myeloma, or something in between. It's the potential side effects from the medications, the transplant, but also your own lifestyle, your own age, and your potential other health conditions or comorbidities. So lots of things at play that might be, stopping you from being able to exercise or do your usual physical activity, but are also the exact reasons why exercise is important. So they can be kind of flipped on you. So I wanted to kind of go through, I guess, a bit of a summary around exercise in blood cancer. So this is a summary of a systematic review that we did in 2021. So there's more research since then, but I'll talk you through the summary. So that included 24 randomized control trials and 3 non-randomized trials. So it was over 2,000 patients if you group them all together. And essentially we did what's called a meta-analysis of 19 of those trials. And, some had different numbers of patients, but generally the evidence found that there was moderate quality evidence that exercise improves your functional exercise capacity. So on a walking test, from pre-exercise to post-exercise, the median difference found was 29 metres. So people are improving from an average of 29 metres from start to finish. There's also improvements in quality of life, improved fatigue, strength, and improved body weight, and improved hospital length of stay. So the strength of this evidence does vary across these studies, which is why I've sort of just put that caveat in that some of the recommendations are moderate and some of them we don't have enough evidence yet to say that it's strong. The nice thing about that, the evidence so far and the research evidence so far, is that there's no significant differences in levels of your blood count, so hemoglobin, platelets, neutrophils, that sort of thing, and no increases in side effects, no loss to body composition, which is a good thing. So we're not, I guess, risking losing any muscle mass. And it's also seen to be safe and feasible in these populations, so people who have blood cancer who are having a transplant. There is more research coming, so I've just kind of highlighted a few that are either in the pipeline or have recently finished. So lots of evidence coming out at the moment. And the shift that we're seeing at the moment is perhaps that we have accepted as a scientific and a general community that exercise is definitely useful and beneficial for people who have blood cancer and are having a transplant. And now the question is, when is the ideal time to put that exercise in the continuum of care? So knowing that, funds are limited and we can't always focus hospital or community or government funds on supporting people with a cancer diagnosis, where should we really funnel those funds? So a lot of this evidence now is talking about prehabilitation, so trying to look at whether actually getting people as fit and strong and healthy as possible before they go in for their transplant, so that prehab, is that going to get you, I guess, the most prepared and I guess sturdy and strong to tolerate the treatment the best you can. And there is, I guess, like a trend to show us that prehab in a general cancer population is extremely beneficial. So now it's more about, is there enough evidence to show that can we extrapolate that evidence specifically to the bone marrow transplant population? And sorry, this slide says SCT for stem cell transplant, but bone marrow transplant, stem cell transplant, I use them interchangeably. So when is the best time? So we know from the evidence that before transplant or prehabilitation, it's safe. Like I said, there is evidence showing that can reduce your hospital length of stay. Just the quality of that evidence is still coming up. So I call it low quality for now. We're still working on the strength of that evidence. In autologous transplants, we've got more evidence showing the benefit of it. In an allogeneic transplant, there hasn't been enough research yet to say that it's definitely effective pre-transplant, but it is showing to be feasible. And self-directed exercise might be more feasible than face-to-face because of the amount of appointments people already have. So got more research coming, like I said. There's lots of research now showing that during and after transplant is safe, feasible, and beneficial. And so we're just looking now about that next step about cost effectiveness. Like I mentioned, like when are we best to channel our funds and support towards these patients? All right, so that's all the sort of science and evidence background. Now, what does exercise look like for you going through your transplant? This is just me being silly saying, expectation versus reality. Science is all well and good, but what does it really look like in real life? And how do you get started? So I like to tell people to just start small. It can be really daunting, like climbing this mountain. You're not going to go straight to the top. You're going to just take your time, zigzag through it slowly, and acknowledge your own capabilities. So look at yourself at this time in your life and what's realistic, what's going to fit in with your symptoms, what's going to fit in with your lifestyles, and think about pacing yourself. So you're not trying to do it all in a big chunk. You're just leaving enough fuel in the tank so that you can still live your normal life and have enough fuel in the tank to cook your dinner or pick up the kids from school or whatever is normal for you. Think about what you enjoy. So for some people, it might be an outdoor activity like walking or cycling. It might be swimming. Some people, it might be dancing. Whatever it is that suits you, Pilates, yoga, Tai Chi, there's lots of things as long as you're getting the physical and mental benefit out of it. And it's okay to seek help, and it's important to know when to seek help, so really listening to your body. These are just a couple of tools. So the next slides are a couple of tools that I like to use around knowing how hard to push yourself and when to adapt. So again, acknowledge that your symptoms will fluctuate. They might fluctuate daily. They might fluctuate even within the day. Or for you, you might have quite consistent symptoms, and it might just be every now and again you have a bit of a setback. So I like to use this traffic light system, and it's sort of just checking in with yourself saying, how am I feeling today? Am I green? Am I orange? Am I red? And so if you think of green like a traffic light, if you're at the lights, it's sort of go as hard as you feel you're able to. If it's orange, okay, you might slow down and just check the safety of everything and maybe go at a slower pace for that day. If it's red, you might actually check in and go, oh, actually, maybe I don't do exercise today, or maybe I just do some really simple activity, or maybe it's a little 5-minute bout of movement rather than a 10 or 15 or 20-minute session. So just adapt and adjust and listen to those symptoms, and always include a warm-up and a cool-down, because there will be times where actually you think, oh, I don't feel so great, and then you start a warm-up and you're feeling quite, your energy levels are starting to increase because you've started moving. You've got that blood flow going, you've got your oxygen going around your body. So just see how you go, and it's okay to start and then go, no, it's too much, or the other way around. How to adapt during your exercises. We often in the, I guess, physio world or exercise professional world, we like to use this Borg scale, where we check in from a scale of sort of 0 to 10 of how hard should I be working. And it's similar for aerobic and strength training. where you want to be working at this moderate or somewhat hard level, where 0 is sort of not working hard at all, you might just be sitting still, and then 10 is you're working very, very hard. So you're checking with your breathing, and you're also checking with how hard your body is working. This is just a really quick graph to show, I guess, remind you guys about consistency. So in this little graph, we just had about, 35 patients where we looked at how consistently they attended exercise. And the yellow at the top is the people who attended the exercises most frequently. And they had a bit of a dip, which is natural from their transplant, but then they came back up stronger than the ones who attended less frequently. And the same thing is to go with your pre-transplant fitness. So the line at the top is the people who were considered not frail pre-transplant or were the most fit pre-transplant, did some exercise, dipped during transplant, which is natural, but then came out of transplant on top, really, because they started off at the fierce level, which again makes sense. So just a little reminder to work at your level, but focus on being as consistent as you can. And I'm sure Sage will talk to you about that as well. A roller coaster to just remind us all that it is very natural that there will be ups and downs, and you might have progression or you might have setbacks. Again, just check in with yourself. Be kind to yourself. It's incredibly normal and human to have those setbacks, regardless of whether you have cancer or not, and what stage of your recovery you're in. Just be kind to yourself. The last couple of slides are sort of just about specific safety and when you might actually want to stop and seek professional help. So I'll slow down for a second here. Some people in the, healthcare setting will have a really good understanding of their health and their current status. And so take with this, take this slide with a grain of salt. If it's all too much for you, that's understandable. But if you have a really good understanding of your medical status and you're aware of when you've had blood counts and hemoglobin, that's going to be handy for checking, if your hemoglobin or platelet levels are low or high. Or maybe it's just taking notes in when you do see your nurses or your doctors. And if they've said, your platelets are a little low at the moment, we might have to consider a transfusion. That's where you might think about just tapering your exercise back a little bit, and rather than doing a high-intensity resistance workout, you might go back and just focus on an aerobic workout or going for a walk or something simple, so that you're not putting too much pressure on your muscles and your joints. Medications, think about what side effects those might have. Again, you will hopefully be informed about whether certain lines or medications might impact your ability to exercise. So a PICC line or report. As an example, if you've got a PICC line, you're going to avoid water and you're not going to do repeated bicep curls, for example, because that's going to put some strain on that line. Think about any pre-existing injuries. If you've got a sore back or a sore shoulder, you're obviously going to need to modify your exercises to adapt. And that's, again, where you might need some guidance from an exercise professional to help you. In terms of when you should really not start exercise or definitely stop and seek support, anything to do with your heart rate feeling abnormal. So if your heart rate is feeling really high or really low, you're just feeling a bit lightheaded or funny, that's definitely not a good time to start exercise, and you should seek support for that. If you have a fall or a collapse, if you're becoming pale or clammy or just feeling really unwell, any chest pain and difficulty breathing, any fevers or bleeding, these are all sort of reasons to go and get help from your medical professional. Again, I guess this is just reiterating when to seek help. So those points that I just mentioned, but also just knowing your body so that you can recognize what feels abnormal for you. So it might not be something I've mentioned, but it might be something a bit different for you. If you feel a bit off, there's no harm in getting medical advice. You'd rather get preventative advice and prevent something bad happening than deal with it later. So you can also always ask for a referral to an exercise professional or seek one independently so that you can exercise under supervision, or if that's something that's going to make you feel more comfortable. There are a couple of specific points that I would say I would advise you to seek an exercise professional to exercise under supervision, and that's bony lesions or bony metastases. So it is recommended, and there is literature to show that it is safer and more effective to to exercise with the guidance of an exercise professional, particularly if you're doing something new. So just so that they can ensure you're doing the correct technique, looking after your back, looking after wherever the lesions are, and they might need to, I guess, adjust your program, for example, in avoiding high impact or jumping. If there are any pains that are new, sharp, neurological, tingling, pins and needles, persisting, definitely seek help for that, because there might be some simple fixes from an exercise professional that they could do to guide you through that and make sure you're getting the most out of your exercise. And also just giving you the confidence to know that you're doing it correctly. And yes, you can do it on your own once you've had some guidance. Don't push through any pain, particularly pain that might feel sharp or neurological. Gone is that whole no pain, no gain mentality. It is about, you will definitely get gains if you're doing exercise the right way, and it's not about the pain of it all. It's about consistency and doing it at your level and feeling comfortable and confident. Okay, so I've talked a lot, but here are some summary take-home messages. So when you are getting started with exercise, start small, acknowledge and respect your symptoms and work with them. Seek professional help when symptoms are persisting, new, or seem abnormal for you. Consider what works for you. Consider your capabilities, your motivation levels, your lifestyle. Consider the physical and psychological benefits that you will get out of exercise. So if you're a little bit unsure where to start, remind yourself of those benefits that are going to come out of it. And it's never too late or too early to start physical activity at your pace. So if it's something that's brand new to you, I guess don't be too daunted or frightened from the word exercise in itself. It can be as simple as just getting moving, getting active. And I think that's all. I think I kind of just want to close on that same quote, that it's a no-brainer, and that it's if you don't do some sort of exercise, you'll just be lying in a bed and you'll be nowhere, like this participant beautifully says. And that is all from me.
Thanks, Shaza. That was absolutely fantastic. And I'm sure we're going to have lots of questions at the end. So without further ado, so just remember to pop your questions in the Q&A or the chat. But I'd like to welcome Sage to give his presentation. Thanks, Sage.
Thanks so much. And Shaza, that was amazing. That was so insightful and got a lot of value out of that as well. And I really resonate with how training is the best form of medication. I say that on a daily basis to a lot of people, whether they have had a transplant or gone through a treatment or not. That's kind of my motto, really. So, yeah, I'm glad that you shared that. So that was awesome. So I was going to pull up my slide here. Before I start, I just want to say again, thank you so much for having me on. I really appreciate this. This is a really a full circle moment. I remember being in his hospital bed. As you can see, I'm holding my donation basically that I was about to receive from my dad for the transplant. And I ever thought, am I ever going to go back to a normal life? And I always wanted to give back to as well once I fulfilled that kind of that achievement. And it's nice to be on the other side. And again, I'm just gonna be trying to provide as much value as I can, because I'm speaking to three people here tonight, and those three people are obviously those who are about to go through their transplant journey, those who are currently going through it, and then those who are coming out of it. So, I mean, I was in all three of those situations, so I know how you feel, because I felt the same way too as well. And again, I found that exercise was the best form of medication. So, yeah, hopefully you can get a lot out of this, and I'm excited to share. So, again, I'm going to go over a bit of my story, and what we'll do as well towards the end, I do want to do a bit of a breakdown of certain exercises to start implementing, whether that is before, during, or after as well. So, as I said, I'll go through my story and the mindset that got me through this, because a big part of my story is, I guess, the mindset that I had coming into this. Obviously, full of emotions. Yeah, not so much highs, but very much lows at times. You go up and down the roller coaster journey, not knowing what's ahead. And but mindset is everything. It's like how you talk to yourself. Obviously, the support is there as well. But yeah, so I'll share a bit more about the mindset as well. So this was the start of my journey. I was diagnosed with leukemia, and I got to a point when um, throughout my treatment, I didn't realize, but at the time, the doctors were already doing a search for a bone marrow transplant, which I never heard of. And yeah, so I wasn't really aware of what that entailed, but I just had to get through the leukemia phase first, and then before I could take that on. So yeah, it was a bit of I guess, a hard journey because I knew I was in that high risk of getting the leukemia again. So, which was a bit of a scary phase. So it was a no-brainer to go through this procedure. But on the bottom left, you can see it's an interesting story, right? I guess in the sense of life can be um, not so much funny, but just interesting. Of like one day, I'm out playing footy, the next day or the next, couple of days after, I'm in a hospital bed being diagnosed with leukemia. So that can be really, like a bit of a shock. And I'm sure a lot of people on this call tonight have been through the same situation, and life does throw us these curveballs. So as we all know, like we face, certain challenges, and a challenge for me was being at a peak, a physical peak of like, playing footy, working full time, really trying to chase goals with footy. But obviously that came to a halt, which was fine. And the biggest thing that I got out of that, actually doing a lot of reflecting over the past at least year or two, but my identity was wrapped up too much in footy. And when that got taken away, I went through the treatment, I recovered, I got back to normality. It was actually interesting, and it was actually nice to take that identity as being an athlete now and just to be myself, which was actually quite liberating, which was nice. Um, but yes, so during this phase, obviously you can see on the right hand side, that's me in the middle of my bone marrow transplant. So um, I had I think that's a central line from memory in the neck, but that was um that was a really hard time for myself, and I'm sure some people on the call are going through the same as at the moment as well. And um, the first question I asked is, what can I still do? And I didn't have control of the circumstance. I had to take it day by day. But what I had control of was my mindset and how I kind of really applied myself on a day-to-day basis. And don't get me wrong, I had some really tough days as well, and I wasn't going to win every day, but some days I really had to be a bit more positive and optimistic of like where I am now and like how I'm going to get through this as well. So I had to have a bit of a mindset shift, and I used what I was able to get from my sporting background and bring it into this arena, which was really helpful. So as I said, yeah, the mindset that kept me going. So there's four principles here. The first one is purpose. So I think the purpose for me, especially also too, was like the purpose to get back to normal life, like normality. I took that for granted massively, and I think this was a massive wake up call. So yeah, every rep, every step was a reason to survive. For myself, was just more, hey, every day I've got to get through this and get on top of this treatment and just recover. Second one was my identity. As I said before, like I had my identity wrapped up in being an athlete. So now I had to bring that to this arena, which was really helpful, especially from day one. Big thing for me was the support I had as well. Support from family, friends, nurses were absolutely incredible, and I'm so grateful for nurses. But I owed them my fight, and well, the most important person I owed my fight to was my mum, actually. So she was my lifesaver. She was my rock. She was there. I mean, my dad and my beautiful sister was too as well. But mum had to play, obviously mum, but also nurse for me during this tough time of the transplant, especially once I came home, just because I was in no state to do things for myself. So yeah, I owe everything to my mum. She's such a beautiful lady. Next thing to focus on is your progress. And this can be really hard too as well, but it's just finding those small little wins on a day-to-day basis. And sometimes those wins are just, getting out of your bed, even going to the toilet or just going for a walk up and down the hall. Um, every day is again so different, and everyone's so like individually so different as well in how they respond to treatment. So just yeah, I think if you can celebrate those small wins, they do compound. And now I'm going to go through a bit more of a roller coaster journey, which some might be able to relate to as well, whether that's hurdles, setbacks, or just slight wins, that you can have throughout your journey. And with the journey, obviously, it comes with the pre-transplant. So obviously the conditioning of the chemotherapy as well. And I remember that was still an intensive week for myself when I went through that. And then after the pre-transplant was actually the day of. So I remember my dad had to go through a certain phase of um, getting it everything's ready for the transplant day. And again, I'm very grateful for him, but that was still really daunting as well, just because I think there's so much emphasis on what's going to happen and obviously the side effects with that too as well. But with that, obviously, being open-minded and optimistic, you have to obviously just go with it. And then um, uh what was going on with that? Yeah, I think you just have to, unfortunately, you go with the flow as well. And I guess the best part about that is like you've just got amazing care from the nurses as well. So that really gives you a bit more clarity too as well. Um, the engrafting stage, that was a challenging part for myself because that was again weeks of isolation. I remember not wanting to really talk to anyone besides obviously my close immediate family. And I remember one day actually I was having a really tough time, probably at my lowest point, and I remember my best mate was trying to call me. I remember looking at it, and I was just like, "No, not today," you know. And I had so many of those days, so a lot of challenges, GVHD battles as well. I also had like a bladder lining issue as well, just from all the chemo. Um, but again, that's just something I went through. And then fortunate enough, you do start to get out of that. You hit the recovery phase, which I did, and that was a really slow rebuild. Again, as I mentioned before, once getting back from hospital, mum had to take full-time care for me for a few weeks, and I was just again pretty all-time low too. Fatigue. I was taking medications. I was taking about 50 a day, which was a lot. It felt like a full buffet for breakfast, lunch, and dinner. Um, but once you get through that, as I said before, you get those little wins where you can, start to feel a bit more energized. You can reduce your medication intake, which is amazing. So it's starting to compound, which leads you, or which enters you into that rebirth stage, which is the greatest stage because that's when you start to form a new identity. And sometimes that can be hard too. And that was extremely hard for myself. But now knowing what I went through and doing some reflecting, I'm so grateful for this stage. So it's like you can return back to normality, you can return back to work or movement, and gives you a bit more purpose as well. Because I think going through something like this is a real, for me personally, it was a big wake up call to be like, hey, I've got to actually really appreciate life more, family, and just really just hone in on just life and how special it is too. As I said before, this hurdle. So this was a photo that my mum took actually, and that was all the tablets I was taking. So that was a lot. But yeah, about 50 a day at one point. So that was all-time high. Um, but as I said, like the best medication, and Shaza mentioned before, is exercise. I didn't know it at the time. It actually had to take me a while, especially after transplant, after I recovered, to actually figure that one out. But I'm sure some of you are aware of the GVHD as well. So my obviously the old cells are trying to attack the new cells as well. So that was obviously, a bit of a roller coaster journey too. Um, and mental fog as well. I think mental fog was a tough one. It feels like you're halfway through a sentence and then that word goes. So that was a bit challenging at times. But again, it's just trying to have a bit of grace and something. I was quite patient as well, but also I was impatient too. But it's just having grace with yourself throughout this time because it is a challenging time. And as Shaz has said, like your energy levels could be high one day and then absolutely low the next. So it's just taking it day by day and just being patient with that too as well. Milestones that mattered. So that's my dad on the left hand side. This was during the on the donation day actually. So this was a proud moment. So he obviously yeah, again, very grateful for what he did too as well. So there's certain little milestones that I was actually reflecting on, and that was saying goodbye to medications. That was a big one for me because that was like about a year and a half of just taking medications, and yeah, that was nice to put those in the bin and say see you later, really. Following that, obviously leaving isolation and just having that sense of freedom for myself, like being at home or even going for walks out in nature near the beach as well. That's really therapeutic for myself, and that might feel like therapeutic for you as well. So it's just like working towards those things that really make you um, obviously therapeutic for yourself as well. Um, Another one, a big thing for me, obviously having that athletic background was getting back into the gym, and obviously I had to wait until um, my immune system was obviously at a point where I could, go back into the public a little bit more. And that was really exciting once I did my first gym session as well, just that sense of empowerment. And obviously, yes, physically that's great, but more mentally, I think that's the most important part. And that's the thing I always focus on for myself and for my clients and just people in general. It's just like if you can really focus on that mental aspect of how exercise makes you feel, that's going to pull you to go do that more than just the physical aspect. So again, it took me a while to get back to my strength as well, rebuilding that phase. And then after that, it was just really nice to see um, I could match where I was prior to treatment as well. So just the consistency of it, as Shazza mentioned, just consistency is everything really. But again, focusing on how exercise truly makes you feel. And then obviously returning to work and normality. I was 22 at the time, so a big thing for me was being out with mates. I did love to boogie, so getting on the back on the dance floor was always fun. So it was a big thing for me. Um, Now, building a new version of yourself, I think this is a important topic because obviously there is an identity that gets left behind, and it's like reshaping your new self. Because for me personally, like my self-image, my confidence, self-esteem, everything was rocked during this treatment. And once you get out of that, it's like you really have to rebuild like a new version of self, which is daunting, but it's also exciting too as well. But it's just like how we approach that, and obviously having that grace with yourself, because over time that is going to naturally, think that will occur. So yeah, giving you having that perspective and that purpose of like, hey, once I'm out of this position I'm in, what's life going to look like for me? Um, Now, this is interesting. A few weeks ago, I was actually on a podcast, and the host asked me this question of what did treatment take away from you and what did it give you? And this was my answer. So, treatment took a version of my old self that I didn't need and opened up a door to a new version of myself that I needed and a life I wanted. And at that time, I didn't know she was going to ask me this question, and I just blurted this out. I don't know how, but again, it made me reflect back to the hospital days. So I remember being in bed and just wishing, I was back to normal life. I also wish, okay, am I ever going to find, a partner that's going to actually um, um, take me for who I am, going through this cancer journey? Am I ever going to have kids, So all those things kind of went through my mind during the time. And it was interesting just I guess, say that. And that's why I wanted to share that too as well, because I think that's a good perspective as well. So yeah, becoming a new version of yourself, like obviously with a transplant too, it's like rewriting your DNA, your identity as well. So my identity shifted from more of an athlete to now it's more number one priorities like husband, father, and now coach, which I'm really grateful for as well, especially being like, husband, father, but being able to coach people who have gone through a similar journey as myself, because there's that instant connection as well. So I really do enjoy helping those clients who have gone through some same experience. Perspective shift, I wanted to share this one too. So how do I get back to where I was pre-treatment to who do I need to become through this process? Again, this comes with grace, but just giving that perspective shift of like, um, you're becoming a new version of yourself. And again, it just takes that time to rebuild. But I think it's knowing, okay, like, hey, once I'm out of this journey, like where do I want to be? Who do I want to be as well? I think focusing on that. I remember days of just always manifesting certain things of like, once I'm out of this hospital, I've recovered, this is where I want to be. So I'm not sure if that's a valuable tip for yourself, but I just want to share that as well. But exercise became everything for me once I start to see the value of it as well. Obviously, the physical aspect's great. I don't really focus that on that at all. It's more just the mental aspect, and all the everything else just comes just by obviously showing up for yourself and really just finding that value of, okay, what does exercise actually do for you, and how does that make you feel as well? I think that's just the most important part out of everything. That's what I really wanted to kind of hone in on as well. Um, and another interesting one was like movement was my way to say I'm still here and I still have control. As you know, throughout treatment phase, there's just sometimes you just don't have any control of anything. But one thing we do have control of is our body and how we move. So moving on, on a small scale might be just going for a little walk. Then you might build up to doing, a couple of push-ups, and then you can kind of go from there. So just remember, yeah, we do have control of our bodies. It's just how we utilize that, and just obviously seek advice to that with that as well. Um, and yeah, so why I exercise and why I coach. So this is a really interesting one. So it gave me back control when I could start to move my body. I could start to feel strong again. My fitness levels were increasing, and it just felt like my old self. So as I said, it was just that rebuild phase, building that new identity, and just really focusing on that too as well. A big thing for me was um, getting into coaching. Actually didn't think I was going to actually coach at all. I was actually in carpentry before and after transplant, but then I somehow got into coaching, which I'm really grateful for. But over time, I just saw the benefits of coaching as well. And my wife and I have a business together now. It's called Strong and Mindful, but we focus more on this, like the strong aspect of moving your body physically, but more mindful as like the mental health of what you gain from moving your body. So that's our kind of philosophy. That's what we like to share with all of our clients. And yeah, I think that's been really helpful for, I guess, me showing up as a coach and being able to, take people through workouts or exercise as well and help them get it back on track. And as I said, like my story isn't unique, but my purpose to share it is because I just see so much benefits of exercise, and just this is what's just helped me. And it's amazing. Like there's so much power behind moving your body. It's just incredible. Another big thing, as I said before, I remember being in bed manifesting. So I actually saw this quote today. I thought I'd just quickly add this in, but become a dream maker, manifesting and living the life you deserve. And I think this is so true. After treatment, it's such a roller coaster journey of so many emotions. And, no one deserves this. So coming out of it, it's just like, okay, life has given you this second chance. Like, what am I going to do with it? And like, how do I, I want to live? And I think it's just about really open up that mind of that, being able to dream again and having that new identity as well. I think that's just so important, and it's exciting as well. So there, even though it's a tough time, there's some exciting times because you kind of can it's like opening up a new book, a new chapter, and you can, put that pen to paper and rewrite a story, which is exciting. Now, this is what I want to get into as well. This is kind of a big component of this. So exercise pre, during, and post transplant. Again, I'll go through a certain examples of this. And as I said, like before, always seek advice too, as Shaz said too. So pre-transplants, that about rebuilding yourself, just kind of building that consistency of getting into the gym or going for walks and just building that aerobic capacity as well as strength training. And as Shazza did mention this before, but I'll just go over a few things. But like greater pre-transplant fitness is better treatment tolerance, which is obviously very true in the sense of just the strength and aerobic capacity as well. Reduces length of hospitalization, preserves muscle mass, which is so important as well. So there's some key elements to this one, but the biggest one is obviously protects mental health heading into isolation. That is such a big one. That's the key component of exercise and why it's so important. So there's a few obviously examples of what you can do, whether depending on where you're at. So whether that's aerobically, you go for 20 to half an hour minute walk. There's some resistance exercises too that you can do, just slowly easing into it. The main thing I always say to my clients too as well, listen to your body, get a good feel for your body. Sometimes too, I remember with treatment, my body just felt out of whack. Even though I had control to move, I didn't actually have control of my body or my muscles. So just being wary of that too as well. A big thing too is flexibility. So ensuring that, you know, daily stretching, especially of the hamstrings, the glutes and the thighs and the hip flexors. They're probably the main areas because obviously there are times where you are sitting down more or you're laying down more as well. And I remember getting really tight hamstring glutes just from not moving. So just something to be wary of. And I did put there that I just want to go over regression. So there are some chair-based exercises if energy is feeling low. So yeah, during transplant, so you can move safely, but obviously just depending on where you're at too as well and what your doctors recommend. So I've got three tiers here. The first tier is bedbound. So if you are bedbound, there's some examples here of what you can do. So such as ankle pumps and ankle circles, just to promote a bit of blood flow as well. Leg raises in bed, seated arm raises. Deep breathing is great too, as well. Just to reduce any anxiety, calm you down as well. Tier two is like limited energy. So if you're feeling okay, but you just want to move slightly, there's some examples there. So a sit to stand on a chair is great. So that's basically just doing a squat just to a chair, but you're sitting down, standing up. Hallway walk, you've got some resistance bands. They're actually one of my favorite pieces of equipment to utilize. I do that a lot for myself, but for my clients as well, because it's a great way to really engage your muscles rather than just, going for dumbbells and stuff. You got more control over that. So I wanted to share that one too. And then the tier three, you got your moderate energy. You can go for a bit more of a lengthy walk. You can just do a little bit more, whether that's aerobically or with strength training as well. Now, I'll go through this with post-transplant. So this is obviously a bit of a longer rebuild phase, and you have to just obviously be aware of where you're at to as well. So what you can do from months 1 to 3, and this is really dependent on how you've recovered with the treatment. So like starting off with like a walking program, chair yoga or breathing is like a great way to restore obviously your baseline function. So just starting small with that, again, just consistency day by day. It might be 5 meters, to the end of the house and back, or you might be able to get out to the street a little bit and come back. So just have a little bit of grace with yourself. Just patience and consistency will help massively. That will compound. Months 3 to 6, obviously you can start to do, just body weight exercises. Just keep it really simple. Again, listening to the body, knowing when to lean in, lean out, meaning how much intensity you put into that session as well. But I guess just focusing on, there's going to be some days where you're feeling really good physically and mentally, and just really utilizing that too as well. And the days that you're not feeling good mentally, especially trying to, do those little things that you can for yourself. Month 6 to 12, this is when you can really start to progress based on obviously where your results are. That's when you can get obviously a bit more consistency with the gym. You can start to either progressively overload over time, or you can just kind of have a bit more volume, add a bit more volume to your session. And then 12 months and onwards, you're basically at that point in the sense of you can start to have specific goals, whether that's, put on a certain amount of lean muscle or whatever that is. But as I said, thrive, not just survive. I think that's a great one too. You want to be thriving, looking to thrive in that, I guess, after those 12 months. And yeah, it's just important to know that everyone starts somewhere. Um, I remember being at a hospital bed and, had to start from basically zero as well. And that was, that was daunting too, because I remember just being so, I had my rugby league background and I had to go back from zero after preseason and all that stuff. So I just, I think just day by day is just the most important thing. So the goal is not perfection, the goal is progress, one breath, one step, one rep at a time. So again, I've put a few more things here for if you are bedbound. There's some stuff that you can do for when you are seated. So chair marching, you can do some seated rows with a band, whether you tie that over a beam or something like that. That's a really great exercise. Some arm circles or calf raises. Then you can get into some walking and some building, which is more like resistance training, adding a bit of like aerobic as well. You can have a little bit of fun with that once you're in that building phase. You can kind of test yourself a little bit. I did find that with what I guess with the transplant, with the treatment itself, there was a lot of adversity there. And the great thing about exercise is it is a form of adversity too, whether you are doing strength training or some sort form of like aerobic, whether that's HIIT or whatnot. You're still going through that adversity. So that really does help, like when you're in the gym or if you're going for a walk. But if you push yourself in a certain way when you're feeling up to it, that can really help on the day-to-day basis. And that's what I found that really helped me as well. So that's why I just wanted to share that. Um, and I just want to go through, this is my second last slide, just the evidence that says that obviously 50% of reduction in hospital stay length with pre-transplant exercise, which is such an important thing to highlight as well. So the importance of exercising. There's a 40% improvement in fatigue levels post bone marrow transplant. This increases, exercising increases your VO2 max, which is really important for aerobic capacity. So reduces treatment of related mortality, and then obviously improves your mood, which is the most important part because there are phases. I know for myself that I went through a bit of a depression phase, a bit of anxiety as well, not knowing what's ahead. So I think that's a key component, and that's something I always will highlight too as well, just the mental health aspect of exercise. And then, yeah, the last one, I just wanted to share this. If you can, you must. I saw this amazing quote from my wife, and this is my beautiful family. And yeah, as I said at the bottom of this, in the end, this is what I fought for. I didn't know what life ahead was going to look like, but again, I dreamt of having a wife. I dreamt of having kids, and I pinch myself every single day now, just knowing that, I've got a beautiful wife that's so supportive. I've got two beautiful boys. I remember the doctor saying might not be able to have kids naturally or whatever as well. And both, Ziggy and then Harley were both natural. So that was a beautiful story. So yeah, if you are someone right now who, is feeling the same way, just know that, you never know what's ahead of you. So just keep fighting. Yeah, as I said, like, your transplant's not the end of your story. It's the hardest chapter and the most important one. So move, breathe, fight, rebuild, and thrive. So thank you guys for allowing me to share. I really appreciate that and hope you got a lot of value out of that.
Thanks, Sage. That was absolutely wonderful. And can you see all of the emojis, all of the love hearts and claps? And it was absolutely wonderful. Thank you for, generously sharing your story with all of us. There is a question in the chat, and I think this question could go to either Shaza or Sage, but perhaps you both have an opinion on this. So the evidence that's been presented tonight, is it only for people who have had an allogeneic transplant, or for both allogeneic transplant and autologous recipients? So Shaza, perhaps we'll let Sage have a breather and we'll ask you that question.
Yeah, absolutely. Thank you for the question. And that was absolutely amazing to hear, Sage. Thank you.
Thank you.
Awesome work. I love it. Sorry, to answer the question. So the evidence that I presented was in a combination of both autologous and allogeneic transplants. So the evidence broadly out there is a little bit more in the autologous population, particularly in, I think I mentioned the pre-transplant setting. There has been a little bit more research in that population, so multiple myeloma population in particular. There's lots of evidence to say that prehabilitation is beneficial and definitely safe and feasible with some guided exercise support from an exercise professional. There is emerging evidence in that pre-transplant phase for allogeneic patients as well. But essentially, in a nutshell, the evidence for both allogeneic and autologous transplant is very strong to show that there is overwhelming benefit of exercise.
Did you want to add to that, Sage?
This is probably it's not kind of in my arena, but I just kind of spoke from my story. So I'll let Shaza obviously Shaza's a bit more knowledgeable in that aspect, but yeah. So I'll let Shaza explain that one.
Thank you. Look, I had a question. How important is it for someone going through a transplant, so either pre, during, or post-transplant, to exercise with someone else, to have, their partner or a friend or their parent or, someone that they trust exercising or moving their body alongside them? So, Sage, I'll ask you that question.
Yeah, that's a great question. I think it's so important because it's a form of accountability. And, in I guess the fitness industry, there's also to like train with your friend, because there's that accountability message, or there's just that accountability of like, hey, I know they're going to show up, I'm going to show up, and then we can train together. So I think the importance of that too, because there's going to be days where you're feeling good to go, good to train. There's going to be days where you're not so much. So I think just having that partner there, whether that's, a spouse or a family member or friend, to be like, hey, no, let's just slowly ease into it, because I think we can quickly talk ourselves out of it, which is understandable depending on how we feel. But I think just having someone there just to slowly push us there if we need to, just go at a gradual pace, I think that is super important. So I highly recommend that.
Great, thank you. Did you have anything to add there, Shaza?
Yeah, I couldn't agree more with Sage, and even just to show, I guess, we did a small research study, and well, we did 2 research projects, and both of them were in a group-based exercise program in allogeneic transplant patients. And we did an aspect after it, which was essentially asking the patients their perspectives and how they felt about participating in the exercise. And there were so many comments and so much feedback around, do not underestimate the psychological benefit of exercising in a group. And it, like Sage said, it keeps you accountable. It helps you have some control of exercising in a group and seeing where other people are in their journey. So you might exercise in a group of people with transplant, and you might actually be at various stages of your transplant, but just knowing somebody else is kind of sharing that journey with you, and you can share those experiences as you're going through it, and you can see people that are ahead of you and seeing that, oh, okay, those people are a month further down the line, and I can see that XYZ gets a little bit better. So yeah, huge benefits to exercising with other people, you know, that either do have cancer or just your own family and partner or friends as well.
Fantastic, thank you. We have come to the end of our webinar. So I want to thank you both so very much on behalf of our audience and Arrow. And you know, it doesn't matter how long you've worked in transplants, we always learn so much. There are so many wonderful people are thanking you on the chat. Jump on the chat and have a look. It's so lovely. Everyone's really enjoyed your presentations. I'm going to hand back over to Ange to bid everyone farewell, but thanks again and have a lovely evening.
Yeah, thank you both so much. It just blows me away sometimes, what we hear from our panelists, and you know, you both had such amazing presentations, but to be honest, I get so much out of these webinars. I really do look forward to them, and I'm sure our audience does too. And I know that you know, sometimes it is like for the likes of yourself, Sage, it's quite difficult to talk about sometimes, but you do it exceptionally well. And we are, yeah, absolutely so grateful for that. And Shaza, you'd be the best physio out there. It's amazing. Yeah, I loved your talk, and it was really, really great. So on behalf of all of us at Arrow, thank you so much for coming on board and being our panelists. We really are truly grateful. It means the world to us. To our audience, thank you all for coming along tonight. We truly value your support as well. This recording will be uploaded and sent to you all once I get a chance to do that, so in the next week. But at the conclusion of this webinar, there is also a short survey, so we would love you to stick around and fill that out if you can. It's completely anonymous, so please be as honest as you can be. And also, if you have any questions regarding anything to do with Arrow, we're here to support you with both emotional and financial support. So please do jump on our website, www.arrow.org.au. Keep an eye out and listen to Yvonne's amazing podcast, The Straight and Marrow. There's a huge amount of amazing information on that too for you all to grab, and I can guarantee you will love that. Absolutely, with everything you've got. And without further ado, I'm going to say goodbye, but do keep an eye out for our next webinar, which is in June, and that will be on the psychological impacts of bone marrow transplant. So it'll be a good follow on actually from this one. So thanks so much to everyone for joining us. Thank you, Sage. Thank you, Shaz. And thanks, Yvonne. Have a wonderful night, everybody, and take care.
Thanks, everyone.
Thank you.
Thank you guys. Appreciate it.
Thank you. Bye.
Yeah.